Evidence that Ebola is rife in the city isn't too clear. Beyond the occasional bucket of chlorine water outside restaurants and shops, there isn't much evidence of the disease. That said, I've spent the day in and out of meetings with Street Child of Liberia's local team, learning much more about what they're doing here on the ground. What they're telling me is that the need is vast. There are hundreds, if not thousands, of children who have been orphaned by the disease. And virtually no other agency is doing anything to respond. There's huge pressures on them to scale up what they're doing. Together we visited one of the interim care centres, which are there to provide a stopgap for kids that have been orphaned, but where there is no obvious new caregiver to reunify them with. I'm happy to say the centre we visited only had 20 kids in. The Street Child's team are doing a great job at reunifying the children with their families, with extended family members, or with family friends, which is a much more sustainable way to provide support to these children. That said, the stories that I've heard time and time again are desperately sad. Cases of kids that have been quarantined after a family member's died. They're kept in their house under quarantine for 3 weeks, and then another family member dies and they're quarantined for another 3 weeks, and then another family member dies, until eventually the child is left orphaned and on their own. And that's not one story, that's many. I spent the early hours of this evening working with our project director, looking at budgets of how much it's going to cost not to reach hundreds more children but thousands more children. And tomorrow we plan on meeting other agencies to see who else we can get behind us to support on the same effort. I'm here at one of Monrovia's interim care centres. All of the children that you can see behind me are orphans. They will have all most recently lost their caregiver. They are kept at the centre while Street Child's social workers trace their relatives who will be willing to take them in. In some situations they're kept here because the most suitable caregiver is sick themselves and are under quarantine, so we have to check their health status before they can take the child or children in. Or in some cases their relatives live much further away, so the process of tracing and reunifying them with them takes much longer.